In this video, we are going to learn about the conditions related to the functioning of the heart. The very first condition is palpitations. Palpitations, if you remember, we calculate the pulse. So it is something related to the heartbeat. So palpitation means the feelings that our heartbeats are unusually strong or very rapid, means running at a very fast rate. Usually palpitations are not harmful but can be a sign of some serious heart condition, because if heart is disturbed it may run at a very fast pace. Therefore, it can be a sign. Now comes the causes of palpitations. If I ask you in your general life, if you are having a fast heartbeat, means you are having a very fast heartbeat, after what condition it happens? It happens after exercise. Therefore, it is written here that strenuous physical activity or intense condition. It may be due to imagination as the heart appears to skip a beat, jump, or race. It is due to mental condition, basically. Second point. Third one is stress and anxiety. Fourth one is abnormal heartbeat, which may be due to smoking, heavy drinking, or intake of caffeine, or increased heart rate with above 100 beats per minute, or abnormal functioning of auricles. Now comes the cardiac arrest. Arrest means there is a failure of heart to pump the blood. Fine. So cardiac arrest is sudden failure of the heart to pump blood, means the heart is arrested. The heart is arrested. Suppose if police arrests a person, what happens? The person is unable to do any work, any criminal activity which he was doing earlier. Similarly, in the cardiac arrest, if heart gets arrested, the function of heart stops. That is the pumping of blood. Its symptoms are sudden collapse because there is no pumping of the blood, so tissues don't receive any blood, any oxygen. So there is a sudden collapsing. No pulse because there is no heartbeat, no breathing, and loss of consciousness. This may be preceded by chest pain, dizziness, shortness of breath, and blackout. Why chest pain? Because heart doesn't stop functionally immediately. It stops slowly. So preceded signs may be seen. Now comes heart conditions leading to cardiac arrest. That is coronary artery disease. Coronary artery, is involved in giving the oxygen to the heart muscle. Now, suppose if coronary artery disease happens, so heart muscles cannot get enough oxygen. If they are not getting enough oxygen, they are not getting enough food. How will they do work? So, there happens cardiac arrest in that condition. Major blood loss. If the blood is already low in the body, so how much blood will it pump? Heart failure, low potassium in blood, enlargement of heart muscles. If the heart muscles will enlarge, what will happen? How it will react? How it will pump? Valvular heart disease or abnormal activity of ventricles. Now come the risk factors of cardiac arrest, that is family history, high BP, smoking, high blood cholesterol, use of drugs, diabetes, and overweight. Now comes the hypertension. Hypertension means high blood pressure. So it is a condition in which blood pressure in artery remains persistently higher than the normal range, that is 120 by 80. It is the normal range. But if the blood pressure is again higher than even 140 by 90 regularly, then it is a condition of hypertension. So what happens in hypertension? The walls of ventricles gets thickened. This causes the cardiac muscles to work harder, increasing the risk of heart attack. Very high blood pressure may cause dizziness. Now comes the causes of hypertension: hereditary factors, cigarette smoking, diet with high salt, obesity, processed food, caffeine, lack of physical activity, stress, use of oral contraceptives, and pregnancy. Now comes the heart attack. So, heart attack means it is not arrested, it is only attacked. The heart muscles can do the work but not efficiently. Therefore, it is written here that it is the decrease in the blood supply to the heart muscles due to clotting or blockage in the coronary artery, which supplies blood to the heart muscles. It may lead heart failure or cardiac arrest. I hope the topic is clear to you. Thank you.